You're listening to the podcast of the Andrea Mitchell Center for the Study of Democracy at the University of Pennsylvania. Our guest today is Eric Orts, the Gardsmark Professor of Legal Studies and Business Ethics and the Director of the Initiative for Global Environmental Leadership at the Wharton School of Business at the University of Pennsylvania. Since the beginning of the current COVID-19 pandemic, he's been writing and teaching about the government response and the implications of the crisis for business, science, and the environment. Eric Orts, welcome to the podcast.
Hi, Matt. I'm really happy to be here.
So we're recording this interview on May 1st, a time when the number of Americans who have died in the COVID-19 pandemic just surpassed 60,000. For those who haven't been following the news closely, can you briefly summarize how the federal government has responded to the pandemic? What has the Trump administration done in terms of testing, mitigation, vaccine development? And how would you compare the job that they're doing to the performance of other countries that have been afflicted by this pandemic?
Well, thanks for that question. You're right. We've just passed a terrible benchmark of more deaths from the coronavirus than we experienced in the Vietnam War. We also have just gone over 1 million diagnosed cases in the United States, and that probably underestimates the actual number of cases that we have. The death count is actually also probably underestimated according to recent information that we have. So we are really dealing with a terrible situation in the United States. And unfortunately, we are leading every other country in the world in terms of the severity of the crisis that's affecting us. In terms of the national response, I think, unfortunately, the answer is we have had almost no national response. We have had and do have some experts who are informing the public about issues like social distancing, which everyone knows the basic rules about now, some hygiene practices. So we have done something in terms of what I would call playing defense with respect to the virus. We know the virus is out there, it's everywhere. Some places are being hit significantly more than other places, and we all know that New York City, New Orleans, Detroit, some other major cities have been hit the worst. But at this point, the virus is everywhere, and so everyone needs to be aware of these defensive measures. The problem, as I see it, is that in terms of the offense, in terms of going out, tracking, isolating, and then killing the virus, the United States has done almost nothing at the national level. And so if you compare the federal government's response, and this really falls mostly on the shoulders of the White House, if you compare the United States response with that of many other countries, we are really far behind. So if you look at China, China has some measures that they could take against the virus that we cannot take in terms of civil rights and that sort of thing. But you look at many other countries which are democratic countries, and they're far ahead of the United States in terms of how they have dealt with the crisis. Leaders in this include New Zealand, Australia, South Korea, Taiwan. If you look at a lot of those countries, they're going down to zero already, and they've had relatively few deaths in particular. And so compared to that, the United States is really doing badly. The one other country that seems to be following an approach somewhat similar to the United States is Sweden. They are not putting up any numbers compared to the United States in terms of the severity, perhaps because they're following social distancing a lot better. They have a better and more equal healthcare system than the United States. But even there, it's looking to me like those countries that have taken a very aggressive offensive strategy against the virus, which includes testing and then contact tracing of the testing, are those countries that are coming out ahead on this. And countries like the United States are really pretty far behind on that. So unfortunately, I have to say our national government response has been a total failure.
Well, we see tweets from President Trump very recently about how the U.S. has tested more people than any other country. How do you evaluate those tweets? What is our testing? What is the state of our testing?
Well, first of all, if you're just going to compare absolute numbers, it's pretty meaningless. Well, we're a huge country, and so if you just say absolutely, we're testing more people than, say, New Zealand, which has had a textbook example of how to control the virus, that's meaningless. What you have to look at is total percentage of the population that's being tested. Do the governors and the medical hospitals that are confronting the need to test people getting the tests they need? And the answers that we see everywhere in the United States contradict directly the president's assurances that he's been giving since day one, that there's plenty of tests. I think at one point he said the tests are perfect. This is all just garbage. The testing has not been available. You have a governor, for example, from Maryland, who's a Republican governor, the leader of the National Governors Association, who has had to kind of tap his own personal contacts through, in this case, through his wife, who knew someone in South Korea. South Korea is dealing with the crisis pretty well, but he had to go over to South Korea to get the tests and had a special purchase. So you see this everywhere. All of the governors have been pretty much universal, unless they're completely tied in terms of a political alliance to Trump, that we need more testing and that the federal government is not supplying it, that there continue to be scarcity of testing. And so, in fact, the testing is still really bad in terms of its availability, as well as its reliability. So, again, what we needed in this case, and we still need, is a national plan to really ramp up the testing. And what we don't need is just lies, essentially, about how great the testing is and false statistics. What we really need is a effective government program to both test and then track. You haven't heard anything about the tracing need. Now, there is one Republican governor again. These are bipartisan issues from the perspective of the governors. The governor of Massachusetts is actually a leader in this. There's a plan. I think one of the best plans that's put out from the national level is from Harvard University, led by Professor Danielle Allen there. And Massachusetts seems to have adopted a very effective tracing strategy to go along with the testing. But if you don't do that, the problem is we're fighting an invisible enemy. If you don't test and then trace the context of the testing of people you know who are positive, you're fighting an enemy that you don't know where it is. And that's why I describe this as just playing defense. It's as if there are a bunch of terrorists out there who are trying to kill you and you have no idea where they are, and you're actually not spending anything on intelligence to try to find out where they are. If you can't find the virus and the people who have the virus and isolate them, then we eventually are going to continue to have this problem going forward.
You mentioned the governor of Maryland. It was actually reported just yesterday that the Maryland National Guard was called in to protect Maryland's COVID-19 testing kits from being seized by the federal government. And this is just one of the ways that the press has reported conflicts between state governments and the federal government. So can you say something about that? Why is this happening? Why are these conflicts happening? And how has this impacted the overall response?
Yes, that's one example, but it's not the only example. What's the problem with not having a coherent and effective national plan for testing and for tracking? But just think about testing and then also having the necessary medical equipment that the hospitals and the doctors need to treat the virus. If you don't have an effective national plan that preempts and supplies everybody according to need, then what you have is 50 different states competing against each other, and then not only competing against each other, but then also the federal government that is coming in to try to get some of these supplies and some of the testing kits and reagents. And so you have chaos. One expert in this area has described a 50-state anarchy of what we're living in. So in a situation which is a national defense level emergency, what you need to have, and what we had in the past, we had a plan in place in the White House under the Obama administration and developed through the Bush administration before that. You had to have a national plan for a strategy. And instead, when you have nothing at the national level, then it all falls on the governors. So the governors, including the governor of Maryland, an example you gave, but also the governor of Massachusetts had a similar experience. This was reported in the in the New England Journal of Medicine, basically had to come to Pennsylvania under cover of darkness. And then somebody from the federal government, Homeland Security, came in and said, no, this equipment is ours. And you have a ridiculous fight between the governor of Massachusetts and the United States government. And I think the only way it was resolved is you called in a congressperson who had a high level of influence with the federal government to resolve it. So this is just totally inefficient, and it's not just inefficient and something that we should talk about in terms of the politics of something, because this results in more people getting the virus and more people dying. And as we started this discussion off, the scale of the number of people dying and getting very seriously ill is staggering. So this failure to get it together from the national government is really putting everybody under a lot of pressure at the state levels.
In a Washington Post piece that you wrote with a co-author last month, you proposed that states adopt what you called interstate compacts to fill this leadership vacuum at the federal level. Tell us, what would interstate compacts do? And since you wrote that, I think in early April, has there been any progress on that front?
Yes. So the basic idea here is that states have the authority to protect their people. So if you think about the basics of the federal system as it's set up in the United States under our Constitution, the national government has powers, but it has powers only when they're given to the national government by the states. So if it were the case, as we were talking about, that we had a national plan and a national preemption of testing, medical equipment, et cetera, and the national government was being effective in rolling that out, then there's no question that the states should stand back and basically just let the national government handle the problem. The problem we have here, though, is the difficulty we have here is that the national government is not acting. So all the states are put on their own. The president himself has said, I don't take any responsibility for this. It's all on the states. Now, one major problem is the states need to fund what they're going to do, so they still need to try to put pressure on the federal government to give them funding, which they'll need to do through Congress. But the basic point of an interstate compact is if you don't have the federal government actually acting and having a plan, then the states have to do it, because a fundamental responsibility of the governors is to protect the people of their states. So they have to step up, and they have been stepping up to say, okay, well, if the government's not doing anything, we have to do it. If the government's not going to set shutdown limits, et cetera, we have to do it. And so that's what you've seen. Now, because of some of the problems we've been talking about, the states competing with each other, et cetera, the states have started to say, we have to really come together. It's going to be better to at least come together as states, as an interstate group, a regional group, than it is to just go on our own. So that's what we've seen since the article that we wrote. And I have a feeling this happened so quickly after our article was published in the Washington Post that I'm sure that this was already being planned in the background. But since our article, there have been interstate agreements, at least that have gone into force in the northeastern states. So that includes Massachusetts all the way down to Maryland, includes Pennsylvania, New York, et cetera. Northeastern states are in an agreement. There's one in the West Coast, which includes Washington, Oregon, and California, which is pretty huge number of the population of the United States. And then there also, more recently, was a Midwestern compact. So the idea of these compacts is essentially that you try to recreate, at least at a regional level, what the national government should be doing. So you would have maybe uniform protocols for what the testing will be. Perhaps we can get uniform ideas about how do you do tracing. As I said, the Massachusetts example is leading the way on this, where they already have in place people they're hiring. They've partnered with a nonprofit group to hire contact tracers. So can you expand that out? That would be another area in which these interstate compacts can be used. And then finally, kind of maybe coordinating your medical equipment. So let's say, for example, New York seems to be past the peak with respect to ventilators. might be that there's going to be a new peak. Perhaps looks like it's okay in Philadelphia right now, but just in case Philadelphia suddenly had a peak, or Boston or DC, you'd be able to allocate some of those ventilators to another place. So you're going to, that would just be one example. Or how do you get the medical equipment? So that's, I think, why we look at these interstate compacts. And since we wrote that, I think there's increasing interest in how those are going to work.
On the question of ventilators, I mean, since you are a business professor, business school professor, I wanted to ask you about the role of the private sector in this COVID response. Early on, it was reported, I remember reading, that the Trump administration was negotiating with a bunch of different American manufacturers to have them start producing more ventilators and PPE, or personal protective equipment. And there was then a breakdown in those negotiations, and then Trump stepped in by invoking the 1950 Defense Production Act, this Cold War legislation. So why did Trump invoke that, and what has he done with it since? And what is the current state of relations between the government and these manufacturers of ventilators and PPE?
Well, thanks for asking that question. And I think that for the most part, businesses are looking for opportunities to deal with the problem and to come up with solutions to the problem. And I think before the administration actually invoked the Defense Production Act, you saw some companies like GM, 3M, et cetera, that were making a huge effort to retool and to try to start to supply some of these needs. I think the president was late, first of all, in terms of invoking the Defense Production Act, but it also appears to me, given recent developments, that he still doesn't really understand what the main purpose of the Defense Production Act is in this context. So, as I indicated, you really should think about, in my opinion, we should think about this as a war, but it's against an invisible enemy. It's not against any human being. It's against this virus, but it is a war. So I think it does make sense to invoke the Defense Production Act when you're talking about the risk to maybe 2 million people at the highest estimates or more by this virus. The problem is the president seems to think that it's okay to use the Defense Production Act, for example, to open the meatpacking plants when people are actually being sickened and are dying in these meatpacking plants. So it doesn't make any sense, right? The answer to the virus is not to produce more meat somehow, that's going to help. What we need is a focus on, as you were indicating, medical equipment, the ventilators, the personal protective equipment for the first responders and for the doctors, nurses, and then now also the testing and a vaccine. So there's some movement on that, but it's really been relatively small amounts of effort from the federal government compared to what we really need right now.
In another piece that you've written about COVID recently, you warned about, quote, a loss of collective belief in the power and authority of science, unquote. But I was looking at some polls, and I learned that recent polls show that Americans express greater confidence in medical scientists than they do in almost any other institution in society. So my question is it really the case that Americans, the population, has lost faith in science? Or rather, is it that politicians and media figures are just not reflecting popular attitudes in their urgency to reopen the economy, for instance? And does this point to a failure in representative democracy?
Well, Matt, that's a very good question, and I think you're right to point out that there's maybe some difference in how I expressed it in the article that was in Knowledge at Wharton and the research that you're indicating. What I at least meant to say in that article is that we need to take this experience as a lesson. So I think you're right that maybe the best responsiveness that we've seen at the national level is when you have briefings by the doctors, like Anthony Fauci being the leading one, who has had a long experience in this. And when he is saying something, people really are listening to him and believe him because he has this long medical experience. So to the extent that the federal government can listen to those kinds of voices, we're better off. And then I think you're right. That's where most people are getting their information, and they believe their doctors. The other point I was trying to make there, though, is that if you look at some of the issues I'm most familiar with, and one of the main ones is our climate crisis, we really have had a denial of science by many politicians, and unfortunately that's translated into much of the public also not believing in the science that's extremely well established among scientists. And you have among those who are practicing this and know about it. And you have that aided and abetted by outlets like Fox News and elsewhere, who also seem to have an interest in denying the science. I don't think there's any other way to look at that except that some interests in the business world, namely the fossil fuel interests at the top of the list, do not want to have regulation, and they want to basically burn baby burn. They want to not pretend that the problem's not there and that their behavior does not need to change. So a possible upside of this whole crisis, and it's hard to find silver linings in such a terrible circumstance as we're in, but one of them might be that we really do get the science, and that this belief in the scientists with respect to the crisis of COVID-19 will also translate over into other contexts where we say, science really is the foundation of the strength of the United States, not just our democratic system and other things. It's also that we are an industrial society that's being driven by science. And so the idea that we're suddenly going to reverse from that, we got to get back off that track. So that's a bright side, I think, is that if we can believe in science again, then I think there's no reason to think we can't bounce back from this problem, and then also tackle climate as the next big problem.
Well, I'm glad to hear you're optimistic. What we're seeing right now is that despite the fact that these COVID-19 deaths are continuing to mount at a rate of around 2,000 a day, I just looked, and for the last week it's been about 2,000 a day, many states are announcing that they're going to start reopening their economies very aggressively in the next couple weeks. What's your assessment of this? What basis do they have to make these decisions? What do you think about when states should reopen? Should it be different from state to state? Should there be a graduated reopening depending on what industries we're talking about? Like, how do you think we should approach this?
Well, just following from the last question, I think the way to approach this kind of issue is by the science. So you have to listen to the epidemiologists and Dr. Fauci. So, for example, I believe Georgia has already opened up. Now, in fact, Georgia is the site of some of the biggest outbreaks that are recent, and you still had outbreaks increasing in Georgia, and there are some serious hotspots there. All of the mayors in the big cities in Georgia, including Atlanta, said, no, please don't do this because you're only going to make the problem worse. More people are going to be infected, and you're risking overflowing the hospitals, which is the biggest concern here, is that you're going to overflow the hospitals, so many more people will die who could have been surviving if they had ICU treatment or a ventilator than they would otherwise. So I think it's clear that states like Georgia, South Carolina, Florida, Texas are probably making a mistake and opening too soon. And that means they're going to have more people who die. Now, it's pretty clear what the reason is for the pressure on a lot of these states, because when you're shutting down, millions and millions of people have lost their jobs. And there's huge pressure being put on people who can't even pay the rent, get food, etc. So that's where the political pressure is to let off the restrictions. The problem is that if you let off those restrictions and then you're killing a lot of people in your state, it's not really clear that you're going to have any economic gain in the long term. It might feel good to go back to work for a few weeks or maybe a month or two. But then if you have another wave of this virus hitting you and you have people in your own family dying and driving it home to you how serious this medical problem is, it's not really the right move. So it is a problem because you have look at Michigan. So Michigan has a governor who has been following the line. And so They're in the Midwestern area where Illinois, Ohio, et cetera, are trying to follow the line on how fast you open. But it's now coming. It's almost looking like armed insurrection that some people are so unhappy about this kind of restriction. So to answer your question with respect to different states having different standards, I think that's true. And even within the same state, so Pennsylvania is an interesting example, my home state. You have the cities like Philadelphia and Pittsburgh who are probably going to have to stay locked down longer just because the risk is so much higher if you start to have an outbreak getting going. In a place like Philadelphia, we could turn it into New York very quickly. At the same time, there are probably lots of parts of Pennsylvania that are more rural, that don't have the same kinds of risk profile that the cities have. And then if you can do this in a measured way without people going crazy and causing hotspots by having a party of 100 people, et cetera, or having concerts again, or, kind of going to movie theaters, if you can have a measured opening of the economy in those places where there's relatively low risk, then that works. Now, one other caveat on that point is that really only works if going back to what we've talked about already, is if you have effective testing. Because if you say, okay, let's the middle of Pennsylvania, you guys go ahead, it doesn't look like there's a lot of cases. If you don't have testing for the hospitals and for the people there when they might get sick, then you can have the virus get a foothold and then get going and kill a bunch of people before you even know that it's there. So that's why this fundamental question of testing is so important. If you don't have that in place, it makes it very difficult for the governors to reasonably start to open their states.
Finally, both you and I are university professors, and there's millions of college students that are waiting to see whether their universities will open for the fall 2020 semester. So what can you tell us about the way universities are thinking about this question of reopening?
Well, as you might imagine, it's a significant and central question for universities like Penn and for all the colleges everywhere. We're probably looking at some colleges going under because of this, because of the stress and the strain on this. It is. I think the question is a little bit out. We don't know exactly what the answer will be at Penn, for example, but I have been involved in some discussions about that. I think there's some idea that you'd have hybrid classes. So if you do bring students back, you would want to, first of all, make sure that there would be very strict rules about social distancing. You'd probably have serious limitations on parties, for example. So the question is, okay, will students actually follow rules like no crazy parties? Hopefully, you would have people following that kind of rule. You probably have to increase enforcement for that. One idea is that people would have tracking. So if we had enhanced testing, would people agree to have to trade some privacy off with more tracking of their movements, et cetera? So if they got tested with COVID-19, would there be an effective way to track who they had interactions with? So I think there's a lot of questions about how you're going to do that. My guess is that at a minimum, you'll have some online presence in the fall. And I think it would be very difficult to maintain the idea that we would all, like this quarter at Penn and most universities and colleges, everybody had to go remote. I don't think anyone feels so good about that experience that they would say that's the norm that we should follow. And so I think most people, if they look at the fall, are saying, it's not really college if it's just online. So we have to figure out how to solve that problem. And I think there are a lot of different options. So another question that we've been looking at is you have to if you want to have more social distancing in the classroom, then you would maybe stretch out the class day. So maybe classes begin at 6 a.m., but they go to midnight or something like that, right? So you have to, people are going to have to be flexible in order to have enough distance between in the classrooms. You might have a class that meets one day in person. If it's a 2-day-a-week class, you might have one day in person where half the class comes and then the other class sees it online, or there's some other kind of arrangement that you have a virtual class and mixing. Now, I guess I will say one other thing about the crisis I think is positive is, at least my experience was that I learned a lot of electronic means that I'll probably use in other classes. So the idea of discussion threads, we have a system called Canvas. There are various kinds of teaching methods that I think are actually really good no matter what. Another feature of online learning is it's a lot easier to get some really important people to come to your class if it's a virtual appearance. And when it's just a classroom and you have someone on a screen, I think people had thought, this is sort of lame. How come I shouldn't say lame, but this is kind of not very positive to have someone come in this way. Why don't we have people, live guests? But I think people are becoming habituated that that's not a bad idea. And then the final positive thing I see coming out of this is that if you look at, again, a question like climate, we probably shouldn't be traveling so much as we are anyway. So a lot of academic conferences, a lot of trips that faculty take, maybe including and trips that students take, maybe we really need to look more carefully at whether we really need to go on the big air trip to burn up a bunch of jet fuel to have these kinds of interactions. We might take this as a positive pause to say, do we really need to do a lot of these things? Can't we do some of these activities online rather than in person, and maybe save the planet, have a better appreciation for where we actually live, that kind of thing. So I think there are some positive ways to think about how this will evolve. My guess is that we are trying to open in the fall. And so if there is, it will all depend on the virus and what we know about the virus as we move through the summer. But my general guess is that most universities are trying to think about opening. Last point on that, related to my idea, or I should say our idea, since I did this with a co-author, of an interstate compact, is that I think also that would be a good idea for colleges and universities to follow. So if you think about my own university, University of Pennsylvania, we're in the Ivy League, but we also have other big universities like Penn State, NYU, who are all in the northeastern area. So my thought there is that the universities should get together and come up with, at least those that are similarly situated, come together and say, here's the protocols we're going to follow with respect to testing, contact tracing, and those how we teach, what are the standards. And if we can kind of come together, that might also allow us to have a good connection with the states, maybe even in those compacts, like the Northeastern Compact of the states might join with a compact of universities and colleges in the Northeast to kind of come up with solutions. And then if you also have a unified collective group like that, you might be able to put some more pressure on the federal government to say, hey, we really need funding for testing and tracing and these other needs. Otherwise, we can't open for business in the fall. That might provide some more incentive for the federal government to help us solve this problem.
Eric Orts, thank you so much for being on the podcast.
Thank you very much.